Hi, I'm Mackenzie Millis, and I'm here at the Arbor Medical Center with Dr. Lala.
How are you?
I'm good. Dr. Lala, I cannot begin to imagine how a resident with COPD begins to choose when there is this many options as far as inhalers. Tell me a little bit of how you make the determination of what's best for each patient.
So within the last year, there has been a flood of new inhalers that have flooded the market for COPD. There are also new guidelines that have come up, basically using the GOLD, G-O-L-D guidelines for treatment of COPD, and that's what I incorporate in my practice and use these inhalers to help assist patients from getting into exacerbations and hospitalizations for their lung disease.
I know COPD in particular is a pretty big focus as far as preventing rehospitalization. I think that's pretty common that we see people that do have issues with COPD and struggle to manage it. Is that something that you and your office can help a resident with?
Most certainly, we try to get the patients within the office within 24 hours of the exacerbation to try to stop the hospitalization. Often now Medicare has now come out with a 30-day rule. They don't want to pay the hospital if the patient is back for the same illness within 30 days. So with the use of the inhalers, antibiotics, therapies that we offer in the office, we try to prevent the hospitalizations early on when the symptoms start occurring.
For a resident that's been struggling to manage COPD for maybe a number of years, do you have any tips or recommendation on what works best?
When patients have severe COPD, there are preventative antibiotics I use in my practice. I found that definitely helps the patients with COPD from getting into the hospital and decreasing the amount of exacerbations that they have.
That's wonderful. Well, we are so fortunate to have you here at the Arbor Medical Center. I would encourage you, we have such great resources here at Shell Point. Between the medical center with our primary care physicians, Dr. Lala and our other specialty services, our physical therapy team that I know works with a lot of COPD patients on helping to manage shortness of breath and different challenges as they're exerting energy and trying to complete activities of daily living. I encourage you, take advantage of these resources right here in our community. Dr. Lala is here in the Arbor Medical Center every Thursday afternoon from 2 to 4:30. If you have any questions about COPD or are interested in scheduling an appointment with Dr. Lala, please reach out to his office. The number is 561-2202.